Dr. Stacey Reading, Associate Professor in the Faculty of Kinesiology at the University of New Brunswick, Fredericton, Canadian Society for Exercise Physiology Master Examiner, and Certified Exercise Physiologist.
The research that I do here would be broadly classified in probably exercise physiology, physiology in general. The use of physical activity and exercise programming, nutritional education, goal-setting types of behavioral modification to try and help older adults change from having a sedentary lifestyle to becoming more physically active. The goal of the programs is to, help prevent or delay or modify some of the effects of various chronic illnesses, especially chronic illness that's based in sedentary behavior. So as we get older, we tend to get a little less active. We start to find more reasons why we can sit down and watch TV instead of getting out and getting physically active. And over the years, that starts to play a toll on our health. And what we try to do is help people kind of get back into physical activity, get moving again, so that they can help take steps to improve their health so that they stay healthy longer. That's the primary goal. Take Heart stands for Take Healthy Eating, Active Recreation today. And the idea is that's what the things that you need to do. You need to take a little heart every day to help improve your health and keep mobile for as much of your life as possible. Part of the research program is really looking at how do we get this kind of physical activity programming and nutritional counseling available to people in their own community. Rather than them having to come to the university, we can actually go to the community, and it's fairly cheap, fairly cost effective. The second kind of primary area of research that we do here is to look at vascular functioning, especially in people who have type 2 diabetes. For a lot of people who develop diabetes, one of the long-term consequences ends up being microvascular dysfunction in the skin, especially in the skin of the lower limb and in the foot. So we put it in topically. And so we've been looking at this approach as a way of supporting wound healing. It's not going to magically cure everything, but it certainly can help support, I think, wound healing. At least that's what we're hoping, and that's what we've been looking into for a number of years. Coming to New Brunswick and doing things like the health study, the obesity intervention that we've done, the Take Heart program, it allows me to take a lot of the stuff that I learned as an undergraduate, a graduate student, as a postdoc, as a research scientist, and then I'll start to be able to use it to actually maybe help people directly. Here we can actually maybe do some good for the health of people.